I better just...
Yeah.
Guys, so I muted everybody so that there wouldn't be a lot of background noise, but you guys should all unmute yourselves. So good luck.
We'll give people maybe a minute or two to come in. Good afternoon, everybody. We're giving people some time to sign in and come in. Welcome, welcome. So another 30 seconds or so, and we'll start. All right. Okay. Good afternoon, everybody. Good afternoon. Welcome to workshop. I think this is workshop 5 for today's session. And the name of the workshop is New Services in a New Normal. So welcome, everybody. We are very, very happy that you chose this particular topic. We know that this is something that everyone will be able to relate to because it's the new normal. And that's what we are exactly going through. We are going through a very, very different environment than even 7 months ago. I mean, that's short. Before I continue, I just want to give my co-presenters a quick chance to introduce themselves before we begin. So how about if we go to Paul, please?
Hi, everybody. This is Paul Margulies from the Center for Practice Innovations. And I see some folks in the chat box talk about how difficult the decision it was for this round. We're so glad you joined us.
Thank you, Paul. How about David?
Yeah, hi everyone. I'm Dave Lowenthal. I'm a psychiatrist. I'm the medical director at the Center for Practice Innovations. It's nice to be here.
Thank you, David. How about Tony?
Hi, I'm Tony Salerno. I'm with the McSilver Institute for Poverty Policy and Research at NYU, and I'm really looking forward to spending this time with you.
Thank you. And my name is Luis Lopez, and I am the coordinator for best practices at the ACT Institute, the Center for Practice Innovations, the Psychiatric Institute right there in Washington Heights, New York City. And we're happy that we're able to do this because this, like I mentioned before, is something that everyone will be able to relate to. And, we want to share some of our thoughts and our work with you. So again, welcome. What we would like everyone to do, please, is take a couple of seconds and introduce yourself on the chat box. And we would love to see your name, your role or position at your agency, and also the region. I think we're very, very interested in seeing what region you're coming from. Are you coming from Western New York? Are you coming from Central New York? Are you coming from Long Island? Are you coming from out of state? New Jersey, Connecticut, Maryland? I know we even got people from Alaska joining us this year. So yeah, please let us know where you're coming from. As you do your welcoming, pretty much it is, I mean, it's clear to say that March, for many of us, was an incredible month because either on a personal level or on a environmental, societal, political level, the world changed for us completely. The world will never be the same. Things have changed to a point where our interaction with most people are virtual. We are walking around now covering our faces, washing our hands. If we wash our hands before 10 times a day, now we're washing our hands 25 times a day, you know, looking at updates on, you know, what's happening, you know, what states are struggling more than others, what's happening with the vaccine. I mean, it is a different world. And based on that, the way things the things we do and the way we do them also change. And this workshop is going to talk about a few of those things because we know that as providers, as peer bridgers, as many of you are, as clinicians, as some of you are, administrators, as some of you are, and as people that are just receiving services. Everything is different now than it was 7 months ago. So we want to talk about best practices in many of those areas that you are living through. So I would like to pass the platform first to David to talk a little bit about how the world is looking today and what our providers' concerns are.
Got to unmute. Thanks, Louis, for that introduction, and hello, everyone. Again, it's a pleasure to be here. And I think while it may seem self-evident that there's a new normal, I think it's helpful for us to at least all acknowledge what that new normal is and looks like. Because I think acknowledging what the world is like and what the limitations are upon us right now is really important. And it's important for us to be effective in the work we do. And I think it's important for our mental health, frankly, in a way that 6 or 7 months ago, we might not have had to do. We could take much more for granted. So the world around us has changed. And the fact is, it's continuing to change. And it's changing in almost every way we live our lives. And I think that's what the new normal is. The new normal isn't static. The new normal is dynamic. It's changing. And as I'm going to point out on the next slide, it's changing in a way that is just full of uncertainty. So, you know, to be concrete for a second, in terms of work, where are you all sitting right now? You know, I'm guessing more of you are at home than in an office setting. I might be wrong, but I would venture to say that. So we're working remotely. There we go. I just saw one in the bedroom. Exactly. I'm guessing there weren't too many people sitting in their bedroom in NYAPRS conferences before this one. Children, if you have young children who are at home who would otherwise be in school, you've got to deal with all of that and figuring out how to manage that. You may have older kids in college. What's going on there? Are you worried about their safety? Are they going into environments where there's a COVID spike? They're coming back home. Are they renting a house somewhere together and doing what college students seem to be doing? In terms of our social contact, I think one thing that's become clear, at least to me and my colleagues at the ACT Institute, and we are social beings, and we really, for the most part, want contact with one another. And in-person contact, as much as Zoom is helping us, is somewhat different than this kind of contact. And so we've got to learn how to manage without the kind of contact we've all had in the past. And then it would be remiss if I didn't add on here social justice issues. That's, for many of you, that is not new. That is old, and unfortunately, very, very old. But for many of us who are trying to be better and move forward, this is new. This is really new, so much more attention to this, and it permeates and should permeate all of our work and what we're doing now. So this is the new normal in the world. Can the next slide, please, Louis? And then there's the new normal in terms of our job. And so that doesn't capture a lot of what I've already spoken about. But I think the main thing here is, for many of us, if we're working remotely, and I think Louis will talk about this when he talks about personal care, in many ways, our professional lives and personal lives have merged in a very concrete way if we're working from home. That separation in space is not necessarily there. And so there's a whole host of challenges in how we're working in terms of dealing with the pandemic. And you know what? Dealing with, I'll say, more than one pandemic, which I'll touch upon in a second. But COVID is not, that does not seem to be going anywhere, right? I mean, it's going to be, I think, a long time, and who knows what the world's going to look like. So the challenge for us is to figure out what we can do in our current work environment to allow us to work as effectively as possible, understanding it's a dynamic situation. And finally, the point I'll make, which I raised before, is uncertainty. There is so much uncertainty we now need to live with and figure out how to deal with psychologically. We've got two pandemics, and by that I mean the very recent pandemic of COVID and the very old pandemic of structural racism in this country. And then we've got a whole host of other phenomena that are very static and that are very dynamic and anxiety producing, and economic, and a lot of economic turmoil, climate change, what's going on politically in this country. And so there's so much that we don't have under control, and human beings like to have control. They like to know they like to be able to plan. So we need to figure out ways to deal with that, both in our personal lives and our professional lives. So I'll stop there, Louis.
Wonderful, wonderful. I want to invite Paul to continue the conversation.
Thank you, Louis. If we can go to the next slide. So we're going to talk about telehealth, and I have a confession to make. Prior to March, I had never heard of Zoom. I spend Monday through Friday somewhere between 6 and 8 or 9 hours a day on Zoom. And that doesn't even count Saturday and Sundays where we do like personal Zoom and family Zoom. I would imagine that at least some of the folks that are out there that are joining us today can relate to that. Our world has changed so dramatically, so quickly. And one of the, I think, amazing and impressive things is how quickly we've been able to do this pivot and change the ways in which we relate to one another. And I want to spend a few minutes talking about that. So if we could have the next slide, please. Thanks, Louis. So just some basics to make sure we're all kind of in the same place. So what do we mean by telehealth? It involves using the telephone or online platforms like Zoom or Adobe or WebEx, or there's so many different ones out there. And at some level, it's about individuals and practitioners coming together to share and to receive some kind of health information. It can be done individually, and I'm sure lots of folks on this meeting can tell us it's also being done in groups. And that was, for many of us, a learning curve to figure out how to do that. There are a lot of resources available to help people use telehealth. I've listed 3 here. The first link is to CPI. Second link is to CTAC, MCTAC. Third link is to NYAPRS. Each of those links could be its own webinar. There is so much rich information out there. And then when you go to the federal government, the state government, there's so much stuff out there. So we're not going to spend a lot of time today going through all of this. Rather, we want to make sure you have the ability to find these resources. And you'll see a lot of stuff out there that can be very helpful to you, whether you provide services, receive services, or just interested in services. Next slide, please. So some more basics. It's important that everybody knows how to use the technology, and that's not a given. For so many of us, this has been a learning curve, and we have to learn from each other and teach one another. I know just coming onto this meeting today, I was worried, I don't know about the rest of my panelists here, that the sound and the video and everything else would mesh, because I've been on a few of these where they didn't mesh. And so, it's always in the back of our minds, and it's been a real learning curve. And my guess is, unfortunately, with COVID continuing into the future, our skills will get better with this. Another really important point, and that is the preferences of participants, the folks who are receiving the telehealth services. They really need to be assessed and understood and honored. Not everybody wants to use video. People may have different times when they are or aren't available and want to meet. How long they're comfortable being online or on the telephone, what you want to focus on. So these are conversations that you want to be having at the beginning of a telehealth relationship, but also conversations that will continue throughout. And just as we've had similar conversations back in the old days when we used to meet face-to-face, we need to have them here, and they really need to be about, these important issues that didn't exist before. Like, are you comfortable coming on video? Should we just do it as a phone call? All those things. Finally, we want to be able to choose locations for everybody involved that are private, that limit distractions, that people feel safe in, where people can be comfortable. I know I've done these Zoom meetings and telehealth calls every part of my house, and there are different parts where I'm more or less comfortable. And so if I'm going to be providing telehealth to an individual, I'm going to check with her or him, around, where they're comfortable, and make sure we can do that. Okay, if we can move on, please. So now we're going to do a polling question. And the way we're going to do this is, if you look at the bottom of your screen, you see that chat, little thing that says chat. And if you click on that little thing that says chat, you can type in a message. And the question here is, are you currently involved in telehealth meetings, either receiving them, providing them, whatever? And if you can people just quickly type in yes or no. And we're going to take a look. We're not going to do an accurate count here, but we're eyeballing what your answers are.
The yeses are coming in faster than we could count, even if
Oh
we
my
could.
God, overwhelming. Overwhelming. So we got our answer there, and the answer is, overwhelmingly, people are involved in these telehealth meetings. Next slide, please. So there's another one of these questions. We'd like you to please use the chat box. How do you feel about providing or receiving these services remotely? And we gave you 5 options, but if you want to use other words, you could use other words too. The best is terrific, mostly good, neutral, mostly not so good, or like really very poor. And we're going to try to monitor and see what people are saying. I'm seeing a range here from terrific to not so good, some neutral. People still typing up. So there's a wide range. And if we had more time, and we will get into a little bit of this, it would be good to know what makes it terrific or mostly good as compared to mostly not so good or very poor. We're going to get into a little bit of that. If we could have the next slide, please, Louis. So this is about the good part. So what are the positives of working together remotely? Can you give us an example? And people can write to the chat box, and we'll read some of them. I see you've even noted there were very few terrifics. Yeah. Staying safe, synergy, safety, more relaxed. Flexibility, I see. Reach more people, allows us to serve more people. Less no-shows and cancellations. Wow, these are moving quickly. I see a lot of flexibility. Somebody has no traffic. I could relate to that one. Able to connect with people across the state. Less no-shows. Transportation is not a problem. Travel, saving on travel and transportation is a big one here. Let me see. Scroll back through here, see what else people are saying. More time, less travel, being able to reach more people. Looking for the themes here, the general threads come here, through here. Flexibility, so there's good stuff. Okay, if we could have the next slide, please, Lewis. But how can things be improved? Give us examples of how things can be improved, what you haven't been thrilled about. Let's see what people have to say. How can we improve telehealth? If you were to give advice, teach providers to use tech. Amen. Less technical problems, better software. The billing, which right now is possible, but hopefully will continue to be in the future. More training for folks, better bandwidth, using FaceTime perhaps as another medium. The unreliability of cell service. I know I lost my online ability yesterday. It was a nightmare. Actual tech. What the doctor is billing for telehealth. It's hard for people who cannot afford computers and the library is closed. What do they do? That is a critically important question. We cannot assume for a minute that people have access to internet, that have access to devices. And then in time, we need to figure out, how do we approach that? Because we know that not everybody has the technology. Yeah, a lot of folks are writing more funding to get devices to people, improved access. Wi-Fi can be an issue. So what I'm seeing, and I'm scrolling through here now, what I'm seeing as a major theme is, let's not forget about the people who can't access, these platforms. People can't get online. Yeah. Thank you for sharing, folks. This is very helpful. Dave, I think I am turning things back over to you now.
Okay. So Lewis and I are going to speak for a bit about self-care. You can go to the next slide, please, Lewis. And again, similar to when we spoke about the new normal, I think we think it's important to first define what we mean. So again, I would divide self-care up into personal self-care, sort of taking care of yourself in all the different aspects of your life, and then professional self-care. And that's the part of personal self-care that's specifically related to one's work. So personal self-care, and we heard a lot about this, I think, at the beginning. And I think at the beginning of the COVID pandemic, and it was about, dealing with what was going on. And I think it was driven a lot by the lack of social contact, the need to quarantine, people quarantining. And so a lot was written about that. And we're going to talk about that in some detail. But I think that because this has been going on for some time, we run the risk of taking things for granted and not being very intentional about our personal self-care. And I think we need to do that. And this includes our physical health, which I think is something that most people usually pay attention to, and even pre-COVID. And if they don't, they're aware of the fact that they're not. But also our mental and emotional health and our spiritual health. And what we need. So this is all under the rubric of our personal self-care. Then we're going to talk a little bit about professional self-care, and that includes staying safe, but it's we view it as broader. It really, I think, includes taking care of your needs, and that includes the needs mentioned above, your emotional, mental, and spiritual needs at work, because we all have them. And again, I think 7 or 8 months ago, we wouldn't be talking about this, but now we need to because the challenges are so much greater. And obviously, this is an artificial divide about self-care. There is a relationship between the two. And I've just put down there a couple of examples of how, if you're not taking care of your personal self-care, for example, and you're really under a lot of stress, that can easily affect your ability to perform your job. Or, worrying about if if you get infected with, with COVID, if you're on an ACT team and going into a neighborhood where there's a high positivity rate and you bring them and you get infected and you are living with somebody who's vulnerable, you may infect somebody at home. That obviously there's a relationship there. To Louis, who's going to talk a little bit about personal self-care.
Thank you, David, and thank you, Paul, also for that outline in kind of reviewing our own personal experiences, right? Because when we talk about this, when we show these slides on the PowerPoint, I mean, these are particular areas that each of us have done some work on and some work with during the past 6 months, right? Even before that, but particularly during the past 6 months, right? Because the workshop is relating to this what we're calling this new normal, right? But the interesting thing is that we are all in it together here. We are all struggling with similar challenges, right? We might be handling and addressing and navigating differently, right? But every morning when we wake up, most of us, if not all of us, are encountering the same challenges, right? Challenges in the area of physical health, challenges in the area of working through the virtual modes. And for those of you that do go to the office, right, trying to get involved and keeping yourself safe, right? And this is why I think it's important to talk about what do I need to do personally, right? Personally, to stay on track, to stay focused, right? To stay alert and guarded, but still do the work I need to do, right? Because all these obstacles continue to be the same, right? So the importance of self-care goes without saying. It is imperative for you to feel well and do the things you need to do to stay focused and to stay alert. And it's like that very famous airline, right, philosophy that you cannot take care of anybody else unless you first take at least a little bit. You got to take care of you, and then you could take that back and help other people, right? Your mental health, your biopsychosocial dimensions need to stay healthy, right? If at any point I feel good physically, but I'm feeling anxious, right? One of the big things about COVID-19 is a correlation between COVID-19 and the high level of anxiety that people are feeling across the board. Everybody's feeling anxious, and the anxiety is coming because no one knows what's next. Nobody knows what's next. Every single person dealing with this is dealing with this for the very first time, right? So you got these experts, right, that are telling you, one thing this week and one thing next week. I understand that. I don't get upset with them. You know why? Because they're going through it too for the first time. It's not like they have this book already on how to deal with this, So we need to take care of ourselves as much as possible, psychosocially, right? Our attitude of leadership is important, right? If you are a leader, an administrator, make sure that you're up to date with CDC policies. Make sure that you are relating information to people. Make sure that you're listening to what people are bringing. And if not, and you need assistance, make sure that you go to those people that might have the information that you need.
Louis, can I jump in for a second?
Please, yeah.
Just to go back to that airplane analogy, because I always found it a simple one, but a powerful one. In the days when we used to fly, could all remember sitting there and watching and you stop paying attention to it. The flight attendant sitting there and the oxygen comes down. And what do they say to you right away? They say, if you're traveling with a small child, put your own oxygen on first, mask on first, and then attend to your child.
That's right.
Why do they say that?
That's right.
Because if you're not taken care of, you can't take care of someone else. And that's the analogy Lewis is making here.
Absolutely.
Many of us in the healthcare professions, or we're working in what we do, might not take care of yourself first. It's really important.
Yeah, absolutely. Okay. And here we get some ideas. Thank you, Dave. Here we get some ideas, right? Exercising whenever you can, even simple walks, If you protect yourself and you distance yourself, you could go outside and do these nice walks, I know people feel restricted at home, but, there's a lot of areas where there's not a lot of people outside, and you could walk and play some nice music and enjoy the day and exercise. Avoid doing things that might not be helpful to your body, things like substances that might not be helpful, overdoing it sometimes with the drinking. Try to avoid that as much as you can. Stay healthy, right? Eat healthy as much as you can. Get rest. If you don't get rest, you don't recover. Recovery is all about resting and kind of re-energizing, regenerating, right? Maintain your faith, your spirituality. Try meditating, try yoga. Try to acknowledge the things that you have been doing. Make sure that you stay in touch with your social supports, family, friends, co-workers. One of the things that we do at the ACT Institute is that we do these check-ins 3 times a week, where we check on each other. And before we start the business, right, we talk about, hey, Dave, how are you feeling today? How are you doing? How was your weekend? Oh, what do you plan to do on the weekend, right? We make sure we check and we stay connected. Make sure that you realize when you're overwhelmed. Overwhelm adds to anxiety. Anxiety adds to stress. Stress makes your body vulnerable. It's not a good combination. It's not a good reaction, right? Chain reaction. So you want to make sure that you scale back as much as possible. You know what? If you don't need to do it today because it's going to cause you a little bit of stress, then try to do it tomorrow. No need to finish everything in one day. Treat yourself with something nice, a nice dinner, a nice TV show. If you need to take an evening off and just Netflix it all night, you Netflix it all night. You know what I'm saying? Do the things you need to do to kind of stay focused and get that recovery that you need, so the following day you're out there fighting again, right? Have some structure at home. I know many of us on this panel today are into working a lot. We work on the weekends, we work in the evenings, we work during the day. But we have to learn from time to time that we have to step out away, and we have to take a break, and we have to relax and do things with the family and do things for ourselves. We need to do that. So these are just important tips that we could consider. And I would like David to continue.
So let me jump in a couple of other points. Can you go back to the previous slide, Lewis? I was going to say a couple of other things. So 2 things I wanted to point out. One, and we've been hearing about this since March. Try something new, a new activity, a new hobby. Something that you have always wanted to do. I think, if you think of it, and I was reading about this recently, preparing for this talk, one of the benefits of doing activities like that is it sort of counteracts the uncertainty and the difficulty we are now having in terms of long-term planning. I mean, it's hard to plan what you want to do 2 months from now, a year from now even. I mean, I have a kid who's trying to get married. We don't know, and he's not sure what he's going to do. And that's not uncommon. So you can get immediate gratification associated with doing hobbies and activities, I think, is more important than ever. The other point I wanted to make, and Lewis and I do support calls for ACT team nurses, and just a shout out to them, because we admire them so much, and they've been out in the community during the whole pandemic, is the importance of taking time off. That's part of taking care of yourself. That's part of putting your oxygen mask on. you need to take time off. And if we had time, I would have asked a polling question of how many of you have taken a vacation in the last 6 months. Even if you can't go anywhere, you need to take time off from work and disconnect. I mean, there may be that occasional person who doesn't do that, but you have to. And it's really part of taking care of yourself. And again, it's easy to fall into the pattern right now of not doing that. I think partially because you don't have many places to go, but I think it's also partially because of the breakdown between work and our personal lives, that work has spilled over into it in such a way that we just aren't taking time off. We need to do that as part of personal self-care. So I would urge you, and risking the wrath of your employers, you could tell them you heard it on this workshop that we're urging you to take vacation.
And Dave, it's interesting because I mean, you make a fantastic point, which is part of the again, the new normal is that one of the things that people used to do to separate work from home is not bringing work into home. But now a lot of people are working from home, so you have no choice now. Work is coming into your house, like it or not.
Yeah.
So how to practice the separation even though work is in your house now?
And I just saw somebody posted in the chat, and time off from technology. I agree. I mean, like Paul, I didn't know what Zoom was either, but I'm not shedding any tears if I'm not on Zoom for a couple of days, and that's different than being around people. And it's the same as we know that it's not good to be on your iPhone or whatever your phone is all the time. It's just not good for us. And again, I think we need to be intentional about taking care of ourselves. So it has to occur to you to do something or do something, because if you don't, I think you run the risk of running yourself down and the consequences of that. So I'm going to say a little bit about professional self-care. And again, there's some references to ACT teams because Louis and I, again, gave this talk to some ACT providers, and and a lot of it was based on the work we've been doing with ACT nurses out in the community in March, in April, in May, in New York City and elsewhere in New York during the surge. And so, professional self-care was literally, I think, a life and death issue for these nurses. And so this is partially based on that, but I'm going to make some other points as well. So part of your professional self-care is about whether you work in the community like ACT teams, or if you're in an office. Right now, you may be at home, and I saw that safety was one of the benefits listed in answer to one of Paul's questions. That may change, or it may not be true for some of you. Some people are going back to the office. So this includes keeping yourself safe, both in the community and in your office. And I'm going to submit to you, and I think it's probably the last bullet on my third slide. And again, this is a reference to the ACT teams, but this has to do with wherever you're working. You really need to take care of the relationships that you have in this work setting you're in, because I think we need to support each other more than ever. And the challenges to supporting each other are greater than they've ever been, I think. And they're not just greater, I believe, I don't know about you, they're not just greater because we're not in physical proximity to one another. They're greater also because a lot of the issues that are arising. I mean, we at the ACT Institute are dealing every day with social justice issues and issues of institutionalized racism, of white supremacy, of what we can do to stop that, and at the same time, both in the places where we're working and with the providers we're working with and with the recipients of our services. And those are issues that could cause a lot of strong feelings on the part of all of us, including people who work. You may have different opinions about those issues. So on the one hand, I think we need to support each other more than ever. On the other hand, there may be very emotional, raw issues that you don't agree with your coworkers on that could get in the way of an effective working relationship. We've got to learn how to navigate that. So that involves respecting one another, listening to one another, figuring out where there are areas of agreement, figuring out where, being open to hearing new ideas and perhaps changing. So I think that might be the most important element of all. I have made reference to a safety module. That's something we're doing for ACT providers in terms of concrete steps to take care of oneself in the community and in the office. I think this self-care, if we're really looking at it broadly, includes relationships with law enforcement now. And look, there have been incidents all over the news, on TV, everywhere. We know what's going on. And so, so I'm not going to make a judgment on what one should do, but just to bring it up as an issue, we had ACT nurses going out into the community, during a surge in New York, who were complaining that they'd come to, they were looking for a participant, they'd come to a block, and there was a block party going on. People not wearing masks, not social distancing, and this isn't in New York City when the infection rate was less than 1%. This is when it was much higher and people were dying, at high rates in the hospitals, and the ICUs and the hospitals were overwhelmed. And so what does one do? One's initial reaction might be to call the police. Is that really what you want to do? Does it depend on the community that you're working in? Does it depend on the relationship between law enforcement and that community? I just raise that as an issue because that is about, I think about professional self-care, broadly speaking. Can I have the next slide, please, Louis? So here are just some, very concrete. So, clearly, we're in the middle of a viral pandemic. So here, if you're going into the community, and this also applies if you're in the office, you may want to check in with people before you visit them if you can. You may want to know who else is living in the home. That's not just, or who is in the home, and that's not just because of COVID, that's because of other issues as well in terms of your own safety. Do you need PPE? Again, at the beginning of the pandemic, we had nurses going out into the community with very little PPE. That's less of an issue now, but obviously around the country, PPE has now become, a political issue, and we have to not let that happen, I think. That's gonna play out however it's gonna play out. But I think for those of you who are where it's actually a professional issue, if you're interacting with others, I would urge you to try to, stay as focused as possible. Do I need this? Do I need PPE? Are the people I'm meeting with me, do they need PPE? Do I need to provide it? Again, this is about taking care of yourself. If you're going in the community, what's the infection rate in that community? If you're traveling with people, are you comfortable doing that? We had ACT nurses who were comfortable traveling with certain precautions with individuals in a car and others who weren't. If you need to social distance, are the people you're with able to adhere to that? So these are all things that, again, I think you don't want to let your guard down. We've been dealing with this for some time. We're going to be dealing with ebbing and flowing of the infectivity rates, it appears. Presumably we're entering a period now where there's going to be a higher rate of infections and then superimpose the influenza season. So I think these are important. Can we go to the next slide, please, Louis? I'll say one last thing about when you're in the community. This was helpful that someone said this to me once, that if you're, as opposed to if you're working really in your office or in a hospital setting, in an emergency room, if you're in someone's community or in someone's home in particular, you're a guest. You're a guest there. And so part of keeping oneself safe, I think, means that when you no longer feel like you're invited or wanted or helpful, you should probably consider leaving. You can always come back. But I think that's sort of a rule of thumb that makes sense to follow. The things I said about PPE and staying safe and taking care of yourself in the office apply as well, in the community, apply in the office as well. And then other common sense strategies, right? And this is, about your physical self-care that I think sometimes gets overlooked, but you want to pay attention to depending upon the setting you're working in. Do you work off hours? Are you working in a place where, do you know where the exits are? Are there other people in the office when you're working? Do you have a cell phone? Is your cell phone charged? I'm talking about very sort of concrete things that we can take for granted that we might not focus on, that don't become an issue until they are an issue. So to me, this is all part of professional self-care. Again, I bring up the issues of local law enforcement and police, and that's what matters. Depending upon what you're doing, do you have a relationship with local law enforcement? What's that relationship like? What's the relationship between local law enforcement like with the people that you're working with? Do you recommend that people call 911? We've seen some tragic consequences there. These are all things I think we've got to think about. And again, as I said before, and I think this would be the final point I would make here, to the extent you're working in a team setting, I don't think the cohesion and unity among team members, and I'll speak of team broadly, that I'm certainly not limiting this to working on an ACT team. This is for us at the ACT Institute. We're a team, and we are taking care of one another and are doing our best to do that and to support each other. And as I said before, that doesn't mean we agree upon every issue, far from it. And in some ways, I think we've got to try to say that's a good thing, because to the extent we represent different points of view and come from different places and have different experiences, that should be helpful to us. And hopefully you can figure out a way to navigate differences of opinion, but at the same time, support each other in taking care of yourselves professionally, to the maximum extent possible, so you're able to be as effective as you can be while you're working. I don't know, Louis, if you have anything else you want to add to that.
Yeah, Dave, before we bring in Tony, because Tony has just a wonderful area of this presentation. I just want to take a minute to survey and a minute just to respond, Dave. I want to ask the group, I imagine there's a lot of people here that work in residential services, and everything you said culminates all together when you work in residential, right? You are in the community, right? The residence that you work in is also your office, right? And you're working with people where people live there. They go out, they come back, and they're there, right? So any thoughts just for a quick minute? How do you keep yourself safe if you work on residential facilities? What are you doing to keep yourself safe? I mean, if there's any responses, we can move on, but I was just wondering, people working in residential facilities, any thoughts?
Louis, should people respond to the chat box?
Yeah, if they could put it on the chat box, would be great. Yeah. Thank you, Paul. If you could just put it on the chat box. And again, if not, I mean, I just give people another 15 seconds. If not, then we'll move on. I'm just, as you were talking, Dave, that just came into my head. Everything you're describing kind of comes together when people work in housing.
Well, just to add to that, we had a comment from somebody saying that in Staten Island, there's a community where people think COVID's a hoax. So add that into the mix of taking care of yourself when there's some portion of the population that just doesn't have the same reality that you have and believes it's not true. So, superimpose that challenge as well.
Yeah, that becomes even more complicated, right? Because then you become the oddball, because you're taking care of yourself and others, and then you become the strange one, right? All right, okay, well, thank you, Dave, wonderful. So you know what? Let's bring Tony, and I just 15 seconds, one of the things that we have had a privilege here in New York State to be the witness of this wonderful workbook called the Wellness of Management. And, we're very lucky in this presentation that we have the two key developers of the Wellness of Management workbook and philosophy, right? Because if you do the workbook, you also follow in a particular philosophy. And Tony's going to talk about some new updates on the Wellness of Management portfolio. So Tony, take it away.
Thanks so much, Luis. Just so that I know how much time I have, do we want to leave some time for questions at the end, Luis?
Yeah, just a couple of minutes. I think people are asking questions as we go through, so.
Okay, great, great. Okay, so if we can go to the next slide. As I'm listening to my fellow presenters, and we're using the term, sort of the new normal, it feels more like the new abnormal, that there's very little in what people are dealing with and facing. This feels really very normal to us at all. And I know we're, so many challenges. Paul mentioned resources that are available to you. This slide deck is a resource to you as well. It's going to be hard to just remember all the wonderful things and tips and suggestions and strategies that folks have recommended, and shared with you. And I think that's what I'm going to be talking about is another resource that's available to you, really based on the wellness self-management approach that Dr. Margulies and I have been involved in. And I guess it really is almost 15 years old by this time. So it really has been a while. And some of you may have used the Wellness Self-Management or Wellness Self-Management Plus program, and you're familiar with, others may not. So let me share what that resource is and how you can access it. Next slide. So just very, very quick background. We developed this over a decade ago, and it really is just a whole set of lessons. That means informational packets, right? Topics that are all designed to support a person in just being able to better manage mental health and substance use issues. And people have used it in groups, or they've used it in individual sessions. It went over pretty well. And as it turns out, it's continuing across New York State and actually elsewhere, which a lot of programs that you begin, we're very pleased and gratified that it's had some sticking value and the folks continuing to use it. So it did get some awards, which means, gee, this really seemed like a really decent professional resource that you guys developed. And not just that we developed, we worked very closely with consumer organizations, with practitioners, with leadership. We understood that this needed a consensus, that all key constituents needed to kind of buy in for this to be really very helpful. So next slide. So it was really across clinical conditions, cultural populations, and service settings. So this is a resource that it doesn't matter really what kind of setting that you're in, or what population you're working with, or actually cultural factors at all. At least that was our best effort. We wanted to make this really broadly available to folks. And a lot of it is really based on shared decision-making, empowerment, self-direction, hope, and recovery. So this is not a prescribed or heavily prescription-oriented kind of approach. And it's embedded with a number of core competencies, because no matter what service you're providing, and if you're reaching out and working with your clients around coping with and managing sort of the consequences associated with this whole COVID experience, that could be an exacerbating factor in addressing whatever challenges folks may have. No matter what the service is, pretty much core foundations for all our work is we have to connect with people. We have to help to activate folks. We have to be able to impart information to folks in a way that is really going to be understood and helpful. And then the cognitive behavioral is, we often are wanting to support and help individuals to kind of think about their attitudes and the ways of thinking and some of their behaviors so that it really works for them. So that's one aspect of wellness self-management, that the materials really were designed to include those core competencies. So if you don't know much about motivational interviewing, or you haven't had much exposure to teaching techniques, or you're not really quite sure about some of these basic cognitive behavioral programs, not to worry, because it really was embedded in the materials itself. Next slide. So let me give you an example of what some of those topics are. And I have to give credit to Dr. Margulies, even though it's hard for me to do that. Dr. Margulies said, hey, Tony, maybe with this whole COVID thing, we can design some lessons that really zero in on COVID, but it's based upon some of the really self-directed adult learning principles that we had used in the wellness self-management program. The format, the design of it, because that's how we did it originally. And the feedback from folks who are using it is that it really made sense to them. And let me tell you, common sense is probably the most critical factor in whether or not something is actually going to be useful or not so useful. So we got together at Paul's suggestion, and we said, well, what would be some of the key topic areas that we really should address that's related to kind of managing and dealing with this COVID-19, situation. And so next slide, these are some of the topics that we came up with. So one thing is, first of all, there's a lot of information out there. And sometimes the information is really confusing. And sometimes the information seems contradictory. And how do you kind of absorb all of that information? Now, in conversation with people, if you impart information to people just by conversation, it's really tough to remember what was said, to be able to access that information when you need to. So we said, you know what? I think this would be an important lesson. Make sure that folks have that foundational information around what this virus is about, the symptoms, how to protect yourself, the kinds of things that you also heard from Dr. Lowenthal and from Luis as well. The other is, this is pretty stressful. So we know that's really important, is to understand our own kind of personal response, stress response to this crisis. Not everybody responds in the same way, but understanding the basic idea of the human stress response and being able to kind of appreciate that. And what are the things that you really worry about? Dr. Lowenthal made a few mentions, right, of the things that really scare people. One is, am I going to get sick, right? If I get sick, am I going to go to a hospital? If I go to a hospital, am I going to die? If my family members get sick. So many worries, then economic worries that people have, their job worries, worrying about your clients that you're working with. So understanding that is pretty important. The other is your own personal signs of stress. People differ in how they respond to stress. Some folks, they have a tough time sleeping. It really disrupts sort of basic routine behaviors like sleeping and eating. For others, they experience it very physically in their body. They get headaches or have stomach upset. There's all sorts of ways. It's important to know and to understand what your unique personal signs of stress are. So we include that as a topic. Next slide. Now, coping, right? And actually, Luis made some reference to, there are ways of coping that are going to work for us. And there's other ways of coping that make perfect sense, but in the long run, they may cause more harm than good. And it's important to kind of figure out what those things are. So you say, look, I'm just going to drink a couple of beers and have 3 glasses of wine, and I know I'm going to feel a lot better, right? And I'm going to feel it's going to be a way of dealing with all this stuff that I'm dealing with. And it's understandable, right? Because it works, at least for a while. It's accessible, and in the long run, it can be harmful. Or ways of avoiding people. Some people kind of shut themselves away when they're feeling under stress. That's their way of coping, more like escaping and avoiding, right? And it makes perfect sense. But in the long run, it can cause more problems than it solves. So understanding, gee, what do I do to cope? Luis had a whole set of slides and ideas of how somebody can cope more effectively, right? Very healthy ways of coping, from exercising to taking walks. Dr. Lowenthal mentioned about, vacation, giving yourself some time and really a break from the technology and the break from dealing with some of the things you're dealing with day in and day out. So having a better understanding of your usual ways of coping, deciding which ones are going to really work for you, and the kinds of things that you may be tempted to use as a coping that will really work in the short run, but could cause you troubles, in the long run. Being connected with others, you've already heard a lot about that. And social support might be one of the most critical factors in helping people get through difficult times, right? And then the last one is staying physically healthy. And as Dr. Lowenthal mentioned, that's an issue as well, right? Both in terms of protecting yourself, and also you may have been dealing with health conditions anyway, right? And you may have said, look, I'm not going to an emergency room because of, I'm really feeling pretty bad, but I'm going to hold off as much as I can. And maybe you were able to, and maybe you had to just go, even though you were scared to death to go to emergency room. Or seeing your regular doctor, for any kind of health condition that you have. That's an issue, right? That's an important issue. And we do find that for many individuals, they have really cut down on the use of healthcare services that they usually would use because of a concern around being in a doctor's office or getting a blood test or going to an emergency room. So those are like, we think, pretty important factors. And then we said, all right, so how do you get this resource or this information so that people can, personalize it, use it in a way that's really relevant for them? So let's go to the next slide. Okay, actually, we're going to bring up the entire workbook, the six lesson, like a little, kind of like a little booklet. We can bring that up, Luis. I want to give you guys an idea what it looks like. And Luis, can you start scrolling up, please?
Okay, I will. Tell me when to stop, please.
Those are the lessons I just mentioned. Keep going. Okay, just keep going. So here is some information. We'll go into lesson 1, understanding the coronavirus. So you'll see there's important information. Keep going. This important information as you go along. There'll be an opportunity for you to think about personalizing it. There's always like a let's get personal. There's one thing about getting information, but people relate and connect to that information in different ways. And so there's always a section on let's get personal, which is how are you, right? What is it you need to learn? Right? About learning about COVID-19, what it is, why it's important, and some strategies, right, is to talk to counselors, case managers, information that you gather in other ways.
Tony, Tony, I'm just interrupt you for a second. Somebody's asking if this workbook is available.
Yes, I'm going to be showing folks the link to where you can download this material.
Okay.
Great. Okay, so as we go along, the next thing is an action step. I mean, that's another part of important learning. So one is important information. Well, how do I connect with this information in my own personal ways? And 2, what do I want to do about it? Maybe areas that I didn't really know very much about. And my action step might be to just read up on that a little bit, or to ask certain questions of my counselor or therapist or physician or nurse that I hadn't really asked before. So the idea of an action step is to use the information that you've just learned, that you've personalized, to be able to take some action steps that will really improve and benefit your life. And then at the ending is just kind of like a summary. So if you're using this with clients that you're working with, we also give some suggestions of how to really start this process from a beginning, a middle, and an end process. And that's like an important thing, is to have a framework in mind. Well, I want to educate my client about COVID-19, the basics, right? And to understand exactly what is going on. What do I need to do? Well, the beginning is the information, the middle is personalizing it, and the end is thinking about how I want to use that information. And it always ends on a positive, affirmative, statement that we think also helps to activate and motivate folks. Next, keep going. Just go up a little bit. I just want to show one more. So what is stress? Why is it important? Again, giving some important information. Keep going. Then you'll see some discussion points. Then you'll see people kind of personalizing. Let's get personal. What are the things you're worried about? And here's a whole list. Now you could ask somebody, what are you worried about? And you may, in fact, get all the information around what are the concerns. But giving somebody a checklist gives them really an opportunity to kind of really explore thoroughly and deeply their worries and concerns. Okay, I think we should stop at this point, because I think I've given you guys a pretty good understanding for each of those topics. That's what you will see. Important information, connecting with that information in a personalized way, having discussion points, some action step, thinking about what you want to do with this. Sometimes the client says, I don't want to do anything with it. It was perfectly fine. Or you know what, I just want to reread it. Can you give me it? Right? I want to have it in front of me. That's the other advantages of a written resource, is that the person doesn't have to try to remember it through conversation, is they have it accessible to them and they can refer to it again when they want. And there's some tools that are built in as well. if people can kind of track, right, some of their times and days when they're feeling particularly stressed out. For some, it's late at night. For some, it could be early in the morning. For some, it could be anytime when they're involved in some kind of an activity. You never know, but this gives people a chance to think about, gee, over the course of a week, where are some of my high points and low points? And that can help a person to make better decisions. Next. All right, let's go out of this and go to the slides. Just want to make sure we have enough time if folks want to ask some questions. I think people got the gist of what each of these lessons, how it's organized. And it's organized in the steps that align and correspond to what we know about adult education. The other is, here are just some tips about how do you introduce this, right? So really, this shared decision making, we take really seriously. And that is to decide whether they want to use these types of lessons. Some folks may do it. Others is like, no, I don't want to read something. It reminds me too much of school. Leave me alone. So it's important to structure a discussion that will help the individual to make an informed decision, right? What am I going to do with this information? How are you going to present it? Technology now is an issue. Some folks are just a phone. How do I get this information? Because this is a resource that really is for the client and for you. As it turns out, these topics are as relevant to providers as it is to clients because we're on the same boat. These are still some of the same issues that we all need to deal with. And so some folks may actually find these lessons useful to apply to themselves, as well as engaging your clients in making a decision of whether they want to, access some of this, whether they want to review this material with you, whether they want you to guide them through this process. And again, technology in some instances could be a help to us, and in other instances may be quite a challenge. But we definitely will give you a very easy way to access these lessons. Next slide. All right, so they're designed to be used remotely as well as in person, individually, or in groups. So some even may prefer a discussion. So some might say, look, I don't know, I don't have it, I can't see it. So you may be on a phone and you may use it as a guide for you, right? Instead of just kind of winging it and just chatting with the person about stress and about coping and about how to stay physically healthy and all those things. You can certainly do that, and understandably so, but you also it may help to shape your conversation. So you may have literally the lesson in front of you and saying, while you're talking to someone, say, Joe, I just want to kind of get a sense of what kinds of worries you may have about this. And so let me just ask you, what is it you're most worried about? The person may give you one or two worries. You may say, I'm wondering if you're concerned about some of these other worries that many people have. And you may literally share that list with the person. And they may say, yeah, I never told you, but I didn't realize that, but I am worried about this particular thing you just said, right? That other people are worried about. So, we're not sure, given your realities day to day, how you might be able to use it, but we want to make sure you have it. We just want you to make sure that you have this accessible to you. Some of you will be able to share it with a client or groups of clients in a group that you're on Zoom. Others will have to adapt based on what your connection with that client is in terms of its remoteness. Next slide. Here are some possible questions. Would you be interested? We have 6 lessons. You can choose some. You don't have to go through all of them. Maybe I'll give you an idea of the different types of lessons. One of them might, kind of pique your interest, right? Or they say, listen, whatever you think. Maybe a client just says, whatever you think. And you may want to start from like lesson 1. Okay? Any questions? Again, the point I really want to try to make through all of this is that wellness self-management, one of its key principles, it's shared decision-making. It's not sort of prescribed to someone, and people aren't really pressured to do something they don't really feel comfortable. And if they say, yeah, I want to do this, I want these resources, I want these materials, I want to talk to you about it, is they do it from a position of being informed. Next. Okay, so I think I already made some of these points here. And So I want to save a little more time for discussion, but I think we've made these points. Next slide. Okay, so this is basically it. You can get in two sites. One is with Dr. Margulies and Luis's, and Dr. Lowenthal. You're with the CPI as well?
Yes, I am.
Okay, so, all those, my colleagues on this presentation are from Center for Practice Innovations. And I'm with McSilver, as I mentioned to you, and CTAC. And so you can get it really in both places, and you just download it, and it's yours. And to use it as flexibly as you see fit. You know your clients, and you know your situation better than we do. But we hope that it's a resource that will help to support your efforts, both applying it to yourself as well as to your clients. So I think that's it.
Well, wonderful. Again, thank you so much, David. Thank you, Paul. Tony, thank you. Wonderful presentation. We are open to talk about anything that we cover or any thoughts that you might have that you want to share on the chat box. While we give people time to kind of process, I want to ask Paul and Tony a two-part question concerning the Wellness of Management COVID-19 lesson plans. The first one is, can you talk a little bit more on how people could use it through telehealth? Because I think that's a key component, right? These have been historically tools that we're using face-to-face, right? So now we have the telehealth, telephonic means that we need to use to do services. That would be my first question. And the second question is, do you recommend this particular version of Wellness of Management to be used also by professionals and providers for themselves? So those are my two questions.
I think for the second question, I think, Tony, you already mentioned, I think this can be helpful for all of us, really all of us. The information here, can be helpful for most anybody, practitioners, folks who receive services, what have you. In terms of telehealth, I think like everything else right now, Lois, we can adapt it to telehealth. We designed this knowing, at least early on, it would be used during this era of telehealth. So it could be used individually as a lesson. It could be used individually as just part of a discussion. It doesn't even have to be a formal lesson. I know more and more individuals are designing groups through telehealth, and we know we've spoken with a number of, say, pros programs that have done that, and it can lend itself to that as well. Tony, I don't know if there's anything else you'd want to add to that?
Well, first of all, you can share these links with your clients so that they can download these materials themselves. So again, if they have access to a computer or have a smartphone, that can be, again, a resource that's available to them, so that even if you're using telephonically and you're not like on a Zoom or have a video type of link, that the person can have those materials, in front of them while you're having a conversation. As Paul is saying, there's nothing that it isn't as if it was designed in a way that would be so telehealth specific, because I don't think there is such a thing as that. But I think you need to adapt it. If you're seeing clients face to face, obviously, that's something you can share. And at the very, very least, it's almost a resource for you to kind of think about and the areas you might want to explore with the client in terms of, like, let's say you're talking about, like, Jay, how you coping with stuff, right? You're on a phone. And, that's kind of a tough question. You may not get a full picture of how the client is trying to deal with things. And having that resource in front of you can give you some guidance on areas of inquiry that I think could be helpful.
And Tony, I just want to underscore something that we put in the introduction, to the 6 lessons. So that is, it's fine to use this as a formal lesson. It's also absolutely fine for it to be part of an informal conversation and to pepper it into conversations. So use it in whatever way makes sense.
But I think the best would be if you, for those clients who would have access to getting these materials, I would I'd help them to get access.
Yeah.
And it's a resource for them, whether they even want to talk to you about it or not.
Yeah.
Excellent. Thank you. Thank you very much. So if we could just go around as the workshop is coming to an end, and I would like to ask each of my co-presenters just to give us like a closing remark or thought that people could take with them as we start closing the workshop for today. And again, before anything, thank you everybody for being part of this discussion. It was an honor to have you participate. And, you know, we got a phenomenal group of panelists. I was very happy to be part of this group of exceptional providers and practitioners and clinicians. So David, any final thoughts?
You know, just to reiterate the point I think I made probably a half a dozen times, that it's more important than ever to be taking care of yourself, to be very intentional about taking care of yourself, and that this is a marathon. You know, this is what the new, as Tony said, the new abnormal, or the new normal, if we want to call it that, is not going away, and the need to take care of yourselves is not going away either. So please do that, and, you know, continue to do that.
Paul?
You know, so much of life is about resilience. And when I take a look and step back and look at the past 6-7 months and how we have adapted to using, you know, telehealth and remote methods, however imperfectly, and sometimes it's better than other times, but bottom line is, for me, it's another example of how resilient we all can be.
Tony?
I mean, with the notion of resilience, the one thing that we do know, the most powerful factor in resilience is that we stick together and you stay connected. And I think that's really sort of the critical piece, because we can only get through this together. And I think that that is an important message. And for the clients we work with, to be able to, as much as possible, help them to stay connected. So I think that's what it's about.
Again, gentlemen, it's been an honor. Thank you very much. This is recorded. You could watch this later on, going back to the NYAPRS website. Thank you, David. Thank you, Paul. Thank you, Tony. Stay safe. Stay safe, gentlemen. We'll talk soon. Take care, everybody.
Thanks, Louis.
Enjoy the conference.